Okay, we are live now.
And start.
Yes.
Okay. Hello everyone. Good morning, good afternoon. I am Sadia Naz from Pakistan. I am very thankful. I am very thankful to International Internship University for giving me the opportunity to speak on the topic of cancer, which is a deadly disease. Now we have to now we have to remember that International Internship University is a leading virtual education system and global brand confederation, which is the most valuable and trusted worldwide and well reputed in delivering innovative programs globally. It is a trusted name for quality training programs and is committed for providing better and virtual education to all the young leaders of the globe. In a short span of time, International Internship University has spread its wings in 126 countries and 6 continents under the strong leadership of its founder, Mr. Pash Padit sir, a committed and inspiring social activist, a passionate educationist from the last 2 decades, providing education to students from various social and cultural backgrounds. Okay, now we have to talk about cancer, a silent killer disease. So today I would like to share that what is cancer, its stages, symptoms, and many more information. Now, first of all, I want to tell you that in the last 50 decades has been a better understanding of the causes and treatment of the cancer. So, first of all, we define that cancer. What is cancer? A term used for diseases in which abnormal divide cells without growth and are able to invade other tissues. We have to see that stigma. Early detection and technology has improved the prognosis of cancer patients to an unprecedented level. Now, I would like to tell you that many people died due to cancer. 5,53,400 Americans died of cancer in 2001. 1.3 millions of new cases diagnosed, 1 in 4 deaths from cancer. Now, in the diagram, you will see that normal cell division and cell damage, no reparation, cell suicide or apoptosis. It means that cell damage to itself. Then we have to discuss that cancer is a large group of diseases that are characterized by cellular malfunctions. We can a local group of diseases. Cancer is a disease in which where cells grow out of control and invade, excite, and destroy normal tissues. So, normal body cells grow, divide, and die in an orderly malfunctions. Cancer can occur at any age, but we can see that 67% of cancer deaths occur in people older than 65 years. It means that it is found in very older people, the people who grows in the menopause functions. Then there are many categories of the cancer. carcinoma, sarcoma, leukemia, lymphemia, and myeloma, central nervous system cancers. So you can see that there are two types of tumors found in the cancer. There are two types of tumors found in the cancer: malignant tumors as well as benign tumors. Malignant tumors spread to other areas in the body, while benign tumors stay in one place. Then common fundamental factors leading to cancer death include tobacco, diet and obesity, infections, as well as radiation stress, lack of physical activity, environmental pollutions. So we can see that there are many causes of cancer, like drinking, excess alcohol, genetic problems. It varies from generation to generation, radiations, viruses. So we can see that there are many common types of cancer, like bladder cancer, lung cancer, breast cancer, which is very common in the age of women. Kidney cancer, we can say it as renal cell cancer. Thyroid cancer, which is found in our necks. So you can see it as there are many new cancers caused by World Area 2008 Worldwide Economics. In this slide, you can see that proportion of cancer caused by major risks and level of economic development. You can see that infection 8%. The people who use tobacco will cause the people who use tobacco will cause the cancer of 16%, and developing countries diet or nutrition due to functions of cancer 20%, infection 26%, and others are 44%. There are many facts which is caused by cancer. In 2014, about 5,85720 Americans are expected to die of cancer. Almost 1,600 people a day. It means that many people are died due to cancer. So cancer is the second common cause of death in the US, exceeded only by heart diseases. Its survival, it has many treatment and preventions. Its treatment are in the form of surgery, chemotherapy, as well as radiations. Now we have to discuss that. There are many new cases found in our country and other countries. In 2010, more than one half of all new cancers of the prostate, female breast, lung, and colon. You can see that female breast is the most common cause of the breast cancer. American Cancer Society projections that many cancers are found in our body, like lung cancer, prostate cancer, female breast cancer, and the colon cancer. Then its treatment very easy: surgery, chemotherapy, radiations. In the case of chemotherapy, drugs were used to kill the cancer cells, disrupt some aspect of cell division, toxic to healthy cells, hair, bone marrow, lymphocytes, as well as epithelial cells of the intestinal lining. Okay. Then we can see that side effect of the chemotherapy is the hair loss, nausea, vomiting, as well as reduced immune response. So second type of the treatment is radiation therapy. In the case of radiation therapy, high energy rays. It means that rays are used in this treatment, used to kill cancer cells, stop them for growing, and it means that it is very local treatment of the radiotherapy. It can affect cancer cells only in the treated areas. So we can see that what's the side effect of the radiation therapy. Its side effects are tiredness, skin reactions such as rashness, redness, and loss of appetite. Okay, then we can see that surgery, which is the treatment of the cancer. In the case of surgery in localized cancer, surgery typically attempts to resume the entire mass. Okay. Then in the case of surgery, many side effects are included, like loss of appetite, diarrhea, weakness, fever. Okay. Then we have to send that recently launched drugs, which is caused by cancer, which is recently then we have to send that recently launched drugs, which is caused by cancer. Axitinib for advanced kidney cancer, vismodegib for advanced basal cell carcinoma, and many more drugs which are used in the cancer. Okay. Then we can see that the cost of cancer, hidden cost of cancer, like health insurance premiums and non-medical expenses, transportation, child or elder care, etc. And exercise regularly, limiting alcohol, maintaining a healthy weight, no smoking or tobacco. Because in today's age, we can see that the people who use tobacco, alcohols may suffer from this disease. So, in the case of all type of cancer, we don't use the alcohol and any other type of nicotines. So, in the age of United Healthcare estimated that 11% of its costs are for cancer care. National expenditure for cancers are 72 billion in 2004, 125 billion in 2010, and estimated to increase to 158 billion in 2020. Then we can see that expand public coverage. In this case, removing Medicaid eligibility categories and raising the income threshold. Then it all the non-orderly, non-disabled citizens. After this, we can see that extends coverage to low-income children, adults, providing them with access to preventive care such as colon and breast cancer screening. Now, I have already discussed that effective cancer prevention, like which we have less chances of cancer, like avoiding tobacco, limiting use of tobacco, and being physically active, seeking regular medical care, screening. Screening is the main cause of that we have to prevent this cancer. Now, second is the breast cancer, reduction of the breast cancer. We have now, I am a girl, I fight like a girl. So we can see that if we have the mammogram test is used for to detect the breast cancer. Start breast is an option for women starting in their age of 20s. And clinical breast cancer, we have to go to the doctor and tell that this problem is with me and what should I do. About every 3 years of women in their 20 and 30, and every year for women 40 and over. So you can see that self-examination of the breast and examine to the collarbone out of entered into the middle of the chest and down to the bottom of rib cage. This is a procedure how to examine the cell breast of the cancer. Then after this, it is the lung cancer. In lung cancer, uh, there is cancer in the lung. Then if you meet all of the following criteria, might be a candidate for screening. 50 to 74 years of age. Then in fairly good health, have at least 30 pack years smoking history and are either still smoking or have quit smoking within the last 15 years. So after the cancer of lung cancer, we have the type of prostate cancer. In the case of prostate cancer, starting at the age 20, it means that this cancer start at the age of 20. Then men should go to the doctor and say that it's my cancer patient, it's my cancer disease, about the pros and cons of testing so that they can decide if testing is the right choice for them. In the second case, if they are African, American, or have a father or brother who had prostate cancer, it means that family history before age 65. Men should have this talk with the doctor starting at age of 45. There is no risk. There is no chance that we stay in home and our cancer will be eliminated. No, we can end the cancer. We can end the cancer at a very high stage. Then, if men decide to be tested, they should have the PSA blood test with or without a rectal exam. How often they are tested will happen depend on their PSA level. So the next level is the 9 actors impact of concerned actions. You can see it as in diagrams where you can find that policy and action for cancer preventions like World Cancer Research Fund and American Institute for Cancer Research. Then in this slide, you can see that who are cancer survivors. Cancer survivors are those people who can diagnosed with cancers and those people in their lives who are affected by the diagnosis, including family members, friends, and many more. In this diagram, you can see that American survey US and cancer survivors by sex and age of January. In this slide, you can see all the information related to it. Then after this, we can see that a national action plan for cancer survivorship. First of all, we can see that achieve the cancer survivorship related objectives in healthy people 2010 that include benchmarkers for success in measuring improvements. Okay, in measuring improvements for addressing ongoing survivor needs. And we can see that implement an evaluation methodology that will monitor quality and effectiveness of the outcome of initiatives. So after this, we have see that translational researches. Then researchers should see that intervention research. In this research, accelerating the translation of knowledge to improve cancer-related fatigue outcomes. After this, it is reflected light of step jobs, a brighter future for pancreatic cancer, viruses, bacteria, cancer, or it's not all smoke and sunlight. Thank you. Then if you know that that you have cancer, then you should must go to the doctor and tell that it's my problem. Then doctor must advise to and go to the and you must go to the proper consultations. Thank you so much. Thank you so much, International Internship University, for giving me the opportunity to delivering this session. Cancer services are widely spread in our society, in our country. So I am very thankful for International Internship University in this case. Thank you.